I feel like I'm doing what I was put on earth to do. I don't know that that makes me a hero. I think it makes me somebody who's doing what they love. I am a registered nurse in the emergency department as well as a nursing supervisor, and I've been with Brookings Health for 12 years. Some days are hard, really, really, really hard. And some days you walk out of here wondering if you even made a little bit of a difference. Some days you walk out of here with huge triumphs and success, but hero is not a term I think the majority of us feel. At the beginning, there was a lot of fear, a lot of uncertainty. We just didn't know what the future was going to look like. It was so new. It felt like we had no information and would have no idea how to treat what was coming towards us. It was almost eerie, wondering what was coming next. We still see a lot of COVID. We also see a lot of post-COVID disorders, people who are just dealing with these long-term effects of having COVID. We still see heart attacks and people who need their appendix out. We do a lot of the infusions for people who test positive for COVID, along with everyday antibiotics, injections, things like that. So the things that we were seeing pre-pandemic, we still see, and maybe even a little more so now. I think there is so much demand, so much stress on a lot of the health systems. We're having to keep people that are more ill and need more specialties because there's no beds, low staff availability at some of the bigger health systems that we've utilized in the past. And I just think that it is system-wide, not even just Brookings Health. I think every healthcare system is feeling the strain of not having enough staff, not having enough beds, not having enough resources. I feel blessed to work here. I think we really do have each other's backs. We want to be there to help each other, support each other. I've seen a lot of people working many, many shifts a week, staying late, coming in early, and that is facility-wide, truthfully. You want to come here because this is like your second family. You know, I look at my coworkers more like family rather than coworkers. And so you want to be there for them in the busy times. And at the same time, you're trying to balance your family life with your work life and trying to find a happy medium. We take our job home with us a lot. We take a lot of the weight of people's health. We worry about people when they leave our health system. We go home and we wonder, what could we have done differently? We take the joys, the sadness, the success, and the failures home with us and for the rest of our lives, truthfully. I think there is a stigma as a healthcare worker to utilize those resources, truthfully. Personally, I lean on my coworkers a lot. I talk with them, I cry with them, we laugh together, we joke together. And for me, that's what I need. That's who I need to reach out to. Some days I drive in complete silence. Some days I jam out to the radio. Some days I cry on the way home because this is a tough world that we're in. I cry for my patients. I cry for my coworkers. I laugh for my coworkers too because we have to keep each other up too and work together. Otherwise, we're never going to get out of this. I think just knowing that people care about us as healthcare workers and support us and want us to have those resources to decompress and be able to come back the next day and be the best that we can be is crazy important. After a particularly hard shift in the ER, I went out our side door, and as the door was closing, I turned around and there were hearts all over the door. And it was such a small act, but for that, it felt so powerful that I went home and I was like, okay, I'm ready. I can come back and do this. People care. It's sometimes hard to utilize those services that say, hey, do you want to talk to somebody? Where when you're in a little more laid back situation with your friends, you can be like, oh my gosh, yesterday was so hard. I feel heavy about yesterday. And being able to break it down with people that you're comfortable with, you trust, you know that they have your back. Even a cup of coffee that gets dropped off to you, just knowing that it's there if you need it. I've always said that we see people on their first day, on their last day, on their best day, and on their worst day. And how we approach that day that they're experiencing can change their whole path too.